Hi, everybody. This is Dr. Lorn Allison with masterthebody.com, and today's podcast is an interview that I was asked to do for being considered an expert in breathing exercises, breath awareness, and therapeutic applications of breathing. The interviewer is Oliver James, the author of the soon-to-be released Big Book of Breath, and that's the title, The Big Book of Breath. So hopefully you'll find some pieces of information or tidbits in here that are useful for you if you're interested in breathing or breath work. We cover quite a bit of ground, so please enjoy.
Who are you? Who are you and what do you do?
My name is Lorn Allison. I am a doctor of nephropathy, which is a connective tissue specialist, joint connective tissue, alignment, bone alignment, spinal alignment, also practicing nutritional work, therapies, enzyme therapy, and so forth. Most of it, from a professional standpoint, started off as, working tissue, working bones, and so forth. And then I got deep into kind of a more integrative model, more holistic in terms of, or what in the States is very popularly called alternative, right? So on the flip side of that, I was studying some esoteric stuff. I was doing yogic concepts, and breathing just really, really, really struck a chord with me. And some of that could be considered mind control and so forth, learning to use the breathing as a lever, of sorts, to leverage some control over your own mind. And some of that from my own early exposure, or issues with anger management and so forth, mood. So what I do with the doctorate and all of that accumulated information is the breathing is integrated into working with patients to help them understand the impact that it's having, not only from the feel good, like, oh, just take a deep breath, which everybody hears all the time, breathe deep, take a deep breath, which is great, but there is a scientific side to that, a fairly deep one. And it's starting to come out now, but I use it therapeutically with people to try to get them to affect their own neurotransmitters, to switch from a sympathetic dominance to a parasympathetic dominance, to try to affect everything from neurotransmitter function to heart rate or heart rhythm issues, trying to get more balance into the body, energy issues, anything you can think of. I mean, digestive obviously gets affected by that. So at my clinic, we specialize in digestive issues, and we get a lot of clientele for that and brain function issues. And, people, I can't think straight, or I'm foggy all the time, and this kind of thing, or I'm tired all the time. And from my opinion, the breathing has a very solid and effective place in that type of treatment protocol. And no one that comes into my clinic essentially walks out without some type of rudimentary understanding of what the breathing possibly could do for them. And you always come at it from trying to be as balanced as possible. Like you alluded to, what's right for you now, what might be right for you later, but it certainly isn't going to work at this time, So that may have gotten into a couple of other questions,
Okay,
but that's essentially what I do with my clinic. And of course, you can get into all kinds of depth with that. So hopefully I'm answering the question without getting too long-winded, but this kind of stuff is sort of my passion, and the breathing to me is extraordinary tool, extraordinary. So I've dug into it pretty deeply over the years. And I like the science behind it, because the science now is really pulling along the understanding, I think, as to why it does what it does and why it's so applicable for all types of issues or medical diagnoses and so forth.
Okay, thank you. And what drew you to this field to become who you are?
From an early age, I've always been very attracted to human potential, human performance. The ability of the human body to be capable of much more than we think, and to kind of push that. Now, what I was actually professionally a musician by trade after the age of like 19 for a long time, and I would use the breathing with respect to that. But from a very early age, about 9 years old, I always wanted to have some type of facility where we worked with what was possible for, a human body-mind complex. And I think the breathing came along pretty early in that process. I think in my early 20s, I had some experiences with breathing techniques, and then I just kind of took the brakes off and tried to work through that whole mess and how to integrate it and so forth. But what really drew me to it was the idea that we are far more capable of things that we didn't think we were capable of. And that was just kind of baked into my character at an early age. Anything that went against the grain or was like, well, you can't do that, why not? So then it drew me into the performance medical field. It's kind of a vague drawing in. There wasn't one dramatic experience, but the breathing throughout has always, I've known it. It's one of those things, and you may have had this experience where it's like you know it, but you're not sure how to prove it. Right. So that's kind of the breathing has been like that for me.
Yeah, I think
now it is being proven. Everybody's researching it.
Yeah, I think for myself, half the book is written from that place of I know it, and I wish for people to not be told it, to experience it.
Sure.
But I'm not always going to be able to tell them why.
Right.
And I trust in time that it'll be clear. But
well, then the breathing, in my opinion, as to what you're saying, is sort of it's a self-teaching technique. So when you not only about physically, mentally, and I think as people go through it and they work with certain things, that they're going to learn better for their body-mind complex, what is best for them. Like you're saying, what's going to work now may not work 6 months from now, but it's good up until then. But then a lot of people don't know how to shift gears away from that and be like, oh, well, then I'm going to evolve into the next cycle, in terms of what works for me then. It's a constant, I think, evolving or, peeling of the onion, so to speak. But I think people need guidance through that because a lot of it, there's a lot of techniques being pushed out there and floated out there. And then I think some people are like, well, I have to do this technique. But then they either lose interest in it, which is, another argument you could have. Well, that you have to push through that too. But that's a whole nother discussion.
Okay. And now I found you on the internet. So can you tell me a little bit about that?
I'm from before the internet, so which is interesting to me to watch that whole thing evolve. But now we're actually really focusing on trying to disseminate information, and I think the breathing is such a big deal that I started incrementally putting up a few videos about that. We're doing more now because I think with the clinic you can only reach so many people at one time, or even across time. And obviously the internet's a platform where there's an enormous amount of information that can come out. And I think what I've found is that I was trying to take my individual sessions, and a lot of the things that we do there are applicable to large numbers of people. Obviously some things aren't, but I think that information could be taken to another level and reach much larger numbers of people so that they have tools to work with. So anyway, that's kind of the gist of that. Okay. We only have some of the breathing stuff up online at the moment.
All right. And then what is you have a channel, is that right?
Master the Body is the YouTube channel, and the website is masterthebody.com.
Right. So you've mentioned, you sort of talked about this a little bit, but I'll just ask it again and then you can work out what you'd like to say. How does breath interact in the work that you do?
A lot of people come into my clinic with digestive problems, hormone problems, musculoskeletal problems, purely bone, joint, connective tissue issues. We do get a lot of people with fatigue, brain fog. If you talk to anyone these days, it seems like it's prolific around the world, really, because we have quite a few clients in different countries. One of the things that I do, and I do it from a clinical standpoint, meaning scientific backing, right? Medical standpoint, we use the breathing to incorporate it in with certain treatment protocols that may include either rehab, physical types of exercises, nutritional therapy, enzyme therapy. To me, the breathing has to be integrated into that, along with diet. If you think about the dominance, right, of how important your breathing is versus how important your water consumption is versus your food. Your food's, down here, and the water's up here, and the breathing is off the scale, right? So the breathing has to be part of a therapeutic approach from my standpoint. Every patient has to have some type of technique that they can use that will augment a treatment process that I use in the clinic. Now, that could be anything from trying to lengthen out their breathing pattern if they breathe too quickly or they hyperventilate, to shortening it to try to drive more energy, right? And those are generalities, obviously. Some people are very, very sympathetic dominant, which you may already kind of know that lingo, fight or flight. Everybody's heard that whole thing. And so you can very specifically address their breathing to collapse down the overage of sympathetic activity and try to expand the parasympathetic, right? And that's just human physiology. So whatever's applicable, try to do it as needed. But oxygen is an issue for the majority. We try to use that along with supplementation and whatever other modalities are needed to get the person where they can stand on their own 2 feet, that they're fully functional, they have the energy they need to get things done and evolve the way that they would prefer to evolve. I think to a lot of people, they're just like, what are you doing? It's like you're trying to get people to be effective in life so that they can accomplish what they want to accomplish, right? I think that's good for everybody. If we had a whole world of that, a good chunk of the issues would, I think, be non-issues. And I think a lot of people are frustrated. They don't feel good. They don't have enough energy. They can't think clearly, or at least most of the time, and these are to me, they're big issues because we need a humanity that is fully functional. So the breathing is integrated into just about everything that I do in terms of from a therapeutic or a medical approach. It's a long-winded answer. I'm full of long-winded answers.
It's a huge question, I have to be honest. Okay. What percentage of your work is breath related? So if you were to sort of chop up what you do, a percentage of it is breath related. Professionally,
I'm always trying to be conscious. It doesn't mean I'm doing aggressive breathing exercises all the time. Sometimes. As far as in the clinic, I would say, I have long sessions with people. Generally it's 45 minutes, an hour. We go over laboratory results. We go over imaging, results that they have. It just depends on the status. So in some cases, I will spend. Some people have already been through it, the whole, so they know, and I'll look at their current sheet and say, okay, have you been doing the breathing? Well, a lot of the time, they're part and parcel doing breathing exercises, but it's a constant reinforcement for me. So at the end of a session, I may say, you really got to do this, or okay, that breathing technique's not working for you because you have an aversion to it. Mm-hmm. So you don't want to do it because it doesn't feel right to you, whether it's subconscious or not. So we try to shift gears, get them to do something that they're tolerant of psychosomatically. And that tends to work a lot better than hammering certain exercises that you have to do it this way and it has to be done, 3 times a day and so forth. So percentage, it's kind of hard to, it would seem like a small percentage because a lot of the rest of it is going over symptoms and, response to treatment and so forth. But almost invariably at the end of each appointment, I'll go over what have they been doing with the breathing, if they've been doing it. Most people are pretty good about it when they see a subjective change. It's one thing to show them videos and show them, well, this is what happens to your norepinephrine, and if you do this type of an exercise, it doesn't quite click. But if they experience it, then they're sold. And so you kind of have to weigh the best way to come at it? Do you get them started with something that might just be pushing the envelope a little bit so that they can see the change, so that they're motivated to do it? Most people, it seems like, at least in the West, I'm not sure about there, in the West, we like to hammer it. Fast, hard, and complete. And so people won't necessarily instigate changes unless they're like, wow, I did that breathing exercise and it totally messed me up. So let's keep working with something, instead of moving into it gently, I guess is the way to say. So, but percentage-wise, I want to say like 5%, but it's not accurate. If you were to take the person's day and say, well, they spent 10 minutes doing breathing exercises and so forth, that was a lot more time than they spent taking a few pills. And in most cases, more time than they spent doing any other kind of exercise. I think in terms of impact, you could probably measure the percentage higher, but I'm just being realistic.
No, it's good to have your accuracy. Is there anything interesting to you that you are noticing in bodies and people that are coming to see you now that is different than when you first started?
Yeah, there's always something interesting. I say we because I have people working with me and they see these things too. They just may not have the perception of it that I have. But, we see seasonal changes and stuff that vary from year to year. One of the things that is, to me, seems fairly obvious, I think maybe not to a lot of people, is like, changes of the seasons. If we're talking about from a respiratory standpoint, that there are bigger issues with changes of the seasons depending on your climate and how barometric pressure changes, humidity changes, temperature changes. Those are pretty telltale every year, even if you don't have allergies. I have to say that I think here, one of the bigger changes that I've seen is the more susceptibility to respiratory initiated problems. Lots of flus, lots of elevated asthmatic problems, lots of inhalant sensitivities. Mm-hmm. And I would attribute that to lung capacity not utilized in most cases. Because, there's a direct correlation with that and your immune function. So there's a lot of interesting things that I see. But in terms of our conversation, that's probably the most relevant. And I walk people through it. If you're not doing some type of isolated breathing exercise, not meaning you go out and run for 15 minutes, then you are statistically very likely as you age to get pneumonia, to get an increased incident of flu, to have serious pneumonia infection as you age because your capacity keeps dropping. So, I can go on, but that's relevant.
All right. Can you give a description of how you interact breath into a session?
Yeah, well, usually I'll have people actually do the exercise. Most of the time, if you're dealing with people who are not feeling well and they're tired and they're brain fogged and all this stuff, and they'll usually come in and they sit in the chair and you say, okay, here's what you got to do. Before we really even get into this, I need you to breathe in only for a few seconds, because most people, by about 2 seconds or 3 seconds, if you say inhale for 4 or 5 seconds, you lost them at 2. They're paying their gas bill or whatever it is. Their mind just takes off, right? Because there's no ability to focus, right? They can't hold it down because they're not used to it. So we'll pick one thing. I'll say, I just want you to breathe in. That's all you're paying attention to, and maybe just for a few seconds. And we're going to do that 3 times or 4 times, just to get the stimulation going into the nervous system to wake them up. Because, inhalation is a sympathetic dominant activity. Not that you're, trying to stimulate fight or flight, but it's just enough to kind of wake the nervous system up to get them to pay attention. And that's one of the ways I integrate it. Then I will actually have them run through a set of breathing patterns. One of the things I do is evaluate them based on what they can do in front of you. So if I say, well, I want you to do this aggressive breathing pattern, and I show it to them, and say, repeat it, and if they do 3 reps of it, and they're like, oh, I'm dizzy, that is enough evidence for me to suggest a breathing pattern based on all the other data that I have. And sometimes if I have no data, it depends on the situation. But almost in every session, I'll have someone do some type of breathing. All you do is start talking about breathing. I don't have to say anything else and be like, they subconsciously are like, oh, that's right, I don't really breathe. It's like a conversation that starts in their own head, and I haven't had to say anything about it, which I think is fascinating. It's like when you start talking about water with somebody, Next thing you know, they reach for their water bottle, take a sip. We have just about everybody in session will do something. Some people can't inhale deep enough to even get their spine erect. Yeah. And that could be because of structural compression issues, something that's been going on for a long time, or it could just be functional, which is they're just so used to that pattern, they don't want to let it go. And you could get into, there's the psychological side of that or the emotional side of it as well. In fact, just Friday, I had someone in that has had long-standing issues with being able to take full breaths. It unhinges this person. You know, they're very, very uncomfortable taking a full breath because it's fear.
Yeah.
And you can get into a whole litany of other things behind that. But I think, didn't you say, what's your background? What's your specialty?
So I am a body-led psychotherapist and a Pilates teacher, and I do a Lomi massage.
Okay. All right, cool.
Pull the whole lot together.
So you can appreciate that, you know, the emotional...
Hugely.
Restrictions, right? And in fact, in the body is remarkable, I think, that way, in the fact that you probably heard of stuff like this where, let's say, a person goes out for a run and they start having an asthma attack, right? And so they have kinesiological triggers that are set up in their nervous system that they're essentially memories. So somehow that's got to be able to be worked through. And like you would know, with any type of body work, the faster way to get people through it, especially if it's something physically painful, is to have them do breathing. Right? Because it releases the tissue much faster.
So, and you just alluded to this already, but is there a case study that comes to mind that represents well the work that you do?
I've got quite a few. I mean, if you want to pick, what area would you want to take one from? Brain stuff, fatigue, digestion, heart, emotional.
So considering that the reader will be reading this about you and your work, is there something that stands out that people will go, right, okay, that's, I don't necessarily mean impressive, but that is significant?
Okay, well, personally, I think one of the biggest issues in society in general is fatigue, right? So if I use that, I think that's probably the most relevant to the largest group of people. So breathing, or certain breathing techniques, depending on the rest of their physiology or their metabolism, we know gets more oxygen into you. I mean, that's just clinical fact. So people who have fatigue, now they could have endocrine problems, they could have neurotransmitter problems, they could be having brain problems. But the breathing still, even if they need other modalities, the breathing still has a dramatic enough effect to alleviate that. So in terms of a case study, I've got one person, young woman, mid-20s, who had actually a number of different issues, one of them being anemia. Now, anemia, for people who don't understand, is essentially, the inability to get that oxygen into the tissue. Now, there's a mechanical reason as to why that happens with anemia, but the breathing exercises can jump some of that. So this young woman had anemia and a couple of different endocrine problems, including a thyroid issue. Lab tested, confirmed, you got the problem. So the first thing we did when we're trying to, I'm going to try to weed through a whole bunch of other issues physically, is you say, here's the breathing exercise I want you to start doing so that we can throw a bridge over this problem so that you have something that's workable for you that is now. So I gave her a breathing technique for the morning, and I gave her a different technique in the afternoon, and it didn't take more than a few minutes each, and that was within the first couple of days. She was already responding to being able to get out of bed much faster. During the middle of the day, if she had an issue, she'd just quietly step out of work. Other people go for smoke breaks. She went for a breathing break. Right. So she would go out, do the exercises, and the beauty of someone doing it like that is that you reinforce it throughout the day, and she's being consistent. So now she's oxygenating better. Now, granted, she's using it up really quickly because her physiology isn't retaining well, but at least it's enough to get her up and running. And actually, interestingly enough, That was before we knew the effect of some of the breathing on neurotransmitters, and it's like norepinephrine, epinephrine. But she remarked clearly that that was what was in the very beginning of a treatment protocol, was able to get her up and functioning, where before she just was like, almost like she was drugged on a continuing basis. Now, she went on to be a great success. This is years later, but she executed it. She did it every day because she noticed that it was working. And without getting into her whole other configuration of what needed to be done, the breathing was a clear path for her. I mean, I have examples of heart arrhythmia, digestive problems. There's a couple of simple techniques that people can do right away. Like if you're familiar with Nali yoga takes some training, to be able to do. But there are other techniques that you can do to kind of compress the intestines, get an effect fairly quickly without really any training. And so we'll use that for digestive issues.
All right. Next question is, what are the limitations that you see in relation to breath?
In my opinion, from a clinical standpoint, the limitations have more to do with giving the person the wrong thing to do at the wrong time. Or I should say, giving them the right thing to do at the wrong time. Breathing, I think, it really depends. I don't want to say entirely, but I think it really depends on the status of that person's physiology and sometimes the metabolism. I think those are really the limitations. And then if you want to get into the more esoteric side of it, I think the limitations are the mind gets pulled into that mixture. And I think what happens is people, if they start doing the breathing more frequently, they start to realize how little control they've been exerting over their thinking process. Because, the breathing certainly brings attention to the mind's monkeyness, or whatever you want to call it, the mind's inability to focus, which is why I think it's been used for so long as a technique in meditation or Eastern philosophy. The limitations, I think, on that are the kind of monkey mind syndrome. The limitations on the physical side are more medical. There's a specific structural or functional problem with the lungs themselves. And you could argue that the breathing will get past that, a lot of it as well. But the biggest limitation, though, I see for the general public is using the wrong technique for them at any given time. I don't really see a limitation with respect to what the breathing is capable of, because we're just getting started with this. And you could say, well, the yogis have been doing it for thousands of years, and that's fine, and they have. But things have changed in that time frame. And I think a lot of what they've taught is still exceedingly relevant. And now with our modern lifestyle and so forth, I think some of the stuff had to be distilled down too, because, most people can't fathom a lot of that stuff. They don't, the Western mind, has a harder time gripping some of those concepts.
All right. Are there types of clients that you feel benefit most from the work that you do?
The people who are willing to do it, really, because I think everybody can benefit from it. I mean, I think the respiratory tract, all of the science that's coming out now, it's one of the greatest pieces of untapped potential we have, period, and in my opinion. Even if we had to survive on less oxygen, and I won't get into that argument, but if we did, this is going to be a major part of that process. And in some places they are on less oxygen, but I think, they used to call space the final frontier, right? I mean, the breathing is, we're looking out, but we haven't spent a ton of time working on the potential we have. My experience has been that breathing patterns are like fingerprints. They're that unique to the individual. We know, breathing patterns change dominant brainwave patterns. I mean, that's been being taught since the 60s, right? So we know that you can give yourself a leg up. You are aware of the things that you can do if we were only to say through the breathing to get yourself to the position where, okay, yeah, now I can actually execute this thing because I've changed my state. So the breathing, not just for oxygenation, but the fact that it has a profound effect on neurotransmitters and central nervous system function. I could give you a different case study, actually, of a patient who was having heart arrhythmias. And they started using one of the breathing exercises. And I said, we really, really, really got to watch this, okay? Because you're activating like dopamine something that's stimulating, and you have a heart arrhythmia. So the interesting thing about that was actually initially that arrhythmia got considerably better. In fact, it was gone. And this is something this person's had, very light arrhythmia, spontaneous, could be any time for any reason, no rhyme or reason to it. And the arrhythmia went away. I mean, it went away for like 6 months completely, right? She's had it for 15 years or 10 years. I can't remember now, but it was long enough. And she kept doing it, and then she got a little more aggressive with the breathing exercise. So next thing you know, I get a call that, oh man, I went from 0 to I've had a total blowout, thinking she had a heart attack and so forth. And everything was negative. Everything is negative. All the labs, all the imaging, all the ultrasounds, everything, right? There's not even plaque in this woman's arteries. And she's over 50. And I said, look, okay, we went through everything. What have you been doing? What do you, blah, 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 blah. Comes down to the breathing. Yeah, I did that, but now I'm doing it this way. So she basically amplified how much she was doing by 3 times or 4 times. And she increased the speed, right? So now she's doing really fast repetitions. And because she just thought more is going to be even more awesome. Well, what it looks like happened to me with all other things being completely the same, the breathing was the only thing that really changed. So I said, you got to back off, So she backed off, and within a week, that was the end of it. Now, she had to find the sweet spot. She had to find the in-between where she's not being too aggressive, but she's not being too laid back about it. And that was it. I mean, it was that simple. It has to be tempered, I think.
Is there any excitement for you in any upcoming research that's going on at the moment? Or certain people?
Oh, yeah. Yeah. Well, I'm always excited about the research, That's, I think the new stuff, which is pretty cool. You've probably heard of Wim Hof, which is an interesting dynamic there, and not only with his character, but what he's bringing to the attention of the research community. Now, I've read through the studies that they did on him, and in fact, I had an interview with him. No, it's probably close to a year now. A lot of people are glossing over, it's like, oh, it's amazing, what you're doing with the breathing and the cold and so forth. And it is. It's really cool. It's really cool. He's bringing a lot of attention for these kind of superhuman reasons, which is awesome. And I think the thing that got overlooked with, instead of just the awe of what he's doing, which it deserves, but is also what's actually in the data. Because the data is really cool. Stabilizing norepinephrine and the effects that it has on the neurotransmitters. And I mean like that. It's instant. So what's cool about that, and what I'm excited about, is there has been a lot of research in the past. It just doesn't get any real attention. So the newer stuff, because he's become popular in the performance areas at least, is that the new attention going into the new research, that they want to find out more. And it would have continued regardless, but it would have been very, very slow because there's no money in it, We know that, right? There's no money in breathing exercises. You can't put it in a pill, and you could sell a book, but you can't swallow it, So I'm really excited about that because I know that the breathing is going to get proved out. I know it. It's already happening. So that gets me very excited. I also kind of, because I'm on the medical side of it, I love to see all the nuances of what happens to nitric oxide and oxygen levels and hormonal levels and, what's happening to the neurotransmitters. Because in my clinic, I do a lot of neurotransmitter work, meaning it's not that it's easily tested. The stuff's not easily tested, but you can go through indicators and typical symptoms and so forth associated with those neurotransmitters. So we try to evaluate as deeply as we can neurotransmitter function, and we know that the breathing has a direct influence on neurotransmitter balances. I think more research is coming that will show how you can affect certain clinical conditions like depression, anxiety, and so forth with breathing patterns. So that's what I'm excited about. I get excited every day because I do breathing every day myself. I love it. When I was in my 20s, I was not well. So now, 20 years later, this is the best I've ever felt. And I think that it is by and far due to the breathing that I do every day. I do supplements and so forth, because I believe in nutrition. But without the breathing, you're crutched. If you don't understand your body-mind complex or your breathing rhythm, your baseline, what you default to, you're crutched.
Okay, well, your excitement is my excitement. What you're talking about there is one of the chapters that I'm writing about at the moment. What I'm having a big problem with is finding this amazing research. I've gone on a lot of websites, and if I'm very honest, the research is boring that I've seen. And for me, so I'm just wondering, where is this research? Like, where is the Wim Hof? Where is it documented?
That stuff was on his website, and I think there's some new ones coming out, but I don't know if they've published them yet or not. You know, because the first set came in and they were impressive, and they're like, oh, we're going to do more. So they started doing more, but I don't know and that was bigger institutions, and so I don't know if they're released yet. A lot of the stuff, you're right, it is boring. So for me, because I get excited about that kind of thing, you know, I can read through, believe me, I've read through enough boring studies. It just, you know, when you're looking at something like, I'm looking for it. Like, I want to know what happens to, were cortisol levels affected? Was epinephrine affected? What have they actually tracked? And so that was, like I was saying earlier with Wim Hof, what I thought was interesting is the interviews he had done to that point, no one really dug into it. But it's right there on paper. This is a big deal, like what's being affected here. That's some of it. There's other ones on PubMed. If you look, they did some research with yoga breathing exercises or yogic pattern breathing exercises, you know, the typical stuff. You know, if you're not familiar with the terminology, it can be kind of difficult to extract the most valuable information from it. There is data there. Before him, there was data there. You know, it's just because of his whole thing, it's more exciting. And I think even though most people, when they look at a study, they're just like, well, I don't know what that is. You know, I don't get it. Things got better. He felt great. He didn't get infected. Awesome. There's something to this. It's legitimate study. So when you see the things in there, like liposaccharide exposure, the fact that he was injected, the group was injected with endotoxin. And they essentially came out symptomless, right? So that's a big deal. What I heard, and I haven't talked to him since, was that they were going to start trying to delineate the breathing versus the cold and which one was doing what.
Right.
And so I think they're going to be very, very surprised, in my opinion, as to it's going to be top heavy on one of the two. I won't say which one. I mean, we know cold has very dramatic effects, but with the breathing, you're driving it. You are driving it. The cold is an exposure, external exposure, and the breathing is self-driven. And so just that by itself brings up a new factor. And they have not tested that. It'll be very interesting to see. PubMed, you know, National Institutes of Health. Yeah. If you do searches for, like, you know, breathing and parasympathetic or some, you know, along those lines, you'll pull up obscure stuff, no one ever talks about, but it's there. The fact that from a neurological standpoint, the cycle of inhalation is sympathetic driven, right? So it activates the sympathetic part of your nervous system. I mean, I'm sure people are talking about it. I haven't heard them talking about it, but maybe I'm in the wrong circles. I don't know.
Yeah, I mean, I think I'm being a little bit dramatic when I say it's boring. I enjoyed it. What I found is it's incredibly simplistic, and I know the Wim Hof stuff is much less simplistic. His techniques are very involved. There seems to be such an emphasis on yoga in the research.
Yeah, sure.
And then also a concern for me around this pulling apart reductionism of yoga or any breathing method. They're like, okay, so yoga is very effective for this, but what part of yoga is effective? Is it the movement? Is it the breathing? Is it the meditation? and they've pulled all three apart, and then they've said, actually, breathing doesn't do so much, but the movement does, and the meditation does. But the truth of it is, that's not how it works.
I think the information is getting skewed somewhere in there, and I'm sure if you put the pieces together, I mean, it's a system.
It's a system, exactly.
It's an 8-limb system, and it has a specific purpose. I understand what you're saying. Everything has to be kept within reason. A body that is a little physically more capable will handle his technique well.
Right.
People who have some compromises, maybe not. In some cases, they may do very well. Being someone who treats people professionally, you're always trying to be conscious of not doing any harm. And breathing techniques are exceedingly powerful. It's just that a lot of the time they don't look that way, and they can be very subtle. There has to be some respect given to the yogic world, the fact that the breathing techniques have historically been broken into, if you're not quite there, you really should not be doing this. You need to build up to it, which I think is true for the most part. It was inevitable, like even in the West here, because Hatha yoga came over, right? So, they basically just took that leg of the system and brought it over and said, this is the best. But I think that's only because in the Western mindset, that's all they could handle. Mm. And in some cases, they can't even handle that. So, but it continues to gain traction, and I think that it will all eventually gain traction.
Yeah.
So I'm with you on that. I think it's a natural occurrence, though, that it would attempt to be deconstructed before it was used as a whole system.
Right.
That's just Western thinking. Break it down into its pieces, research it, be skeptical of everything, and then eventually when it's all proved out, they'll be like, yeah, we knew it was coming, It doesn't surprise me at all. I think in terms of, there are people who were classically trained in yoga who bastardize it. Mm. They come into a different culture, maybe there's some ego involved, and they just want to be like, look at me, check out these techniques and everything. And it was all from that system to begin with. It just, it's inevitable. I think it will come around. The more the research comes out, and then, they'll be like, I won't say anything about anyone in particular, but if someone comes in and says, well, this breathing, I created this breathing technique. It's mine. No, I mean, no, you didn't. It's some way and somehow it's been used by someone before, and they may very well have taught it to someone, So, just the awareness of the concept of breathing, essentially, we took from, if I can be bold enough to say, we took it from Eastern philosophy. I could be wrong, but that's the way it looks to me. So, they're just, it's a Western mindset to deconstruct it first and then rebuild it again and say, check what I just built. Look at that. Isn't that cool? And the same thing is happening now. I think a lot of people do respect the yogic system in the West.
You've also alluded to this. There are some documented negative aspects to breathwork. And I was wondering if there's any that you feel would be important to speak to clients about. And you've already spoken about this on certain breaths, but is there anything else that you would add to that?
We have kind of touched on it already. I think the negatives are whether people can tolerate what it's activating. And some of that, I think, is on whoever they're learning it from, to try to do their best to evaluate whether the person can handle it or not. That's really the negative that I see. And like when I mentioned that, the woman earlier with the heart, what really happened, I didn't want to say it then because I didn't want to make it sound too clinical, but the person is essentially overdriving, they're cranking it out. That ended up overdriving the heart, and it just, enough's enough, basically. So I think there are both possible negative physical and psychological. It's just that, people aren't taught to recognize what that might look like.
Yeah.
But at the same time, you could say, well, if you're uncomfortable with it, don't do it. Mm. But if you look around, I think people aren't uncomfortable enough. And I think that our technology allows us not to be. It's too cold in this room, or, I don't have to go out. I've got food in the fridge. I've got, whatever it is, they don't have to bike places. They don't have to walk places for the most part. Our technology has allowed us to be a little softer. And I think that the breathing wakes things up. And I think people get uncomfortable. And I think that they have to learn the difference between the discomfort of it's making me uncomfortable because I'm not doing enough versus it's making me uncomfortable because it's manipulating my physiology and I'm causing a problem. Mm-hmm. And that's very subtle, though. And I think it's hard to explain that to people because a lot of people in the West particularly, they want to punch it through no matter what. They don't care how painful it gets. In fact, they don't care how uncomfortable they are. And for the most part, that may not be a bad thing. It's just that when it starts affecting them physically. Again, I'm not saying the breathing caused her heart arrhythmia because it clearly solved it in the first place. But I think it's a possibility for the same reason that with someone like Wim's technique or the hyperventilation technique, essentially, is that you have to dissipate that extra oxygen. Mm. And your body will do it automatically, just if you sit there, because it's not balanced, right? So there's a lot of benefit that comes from it. It's still going to temper itself. The body's going to come back to normal. It's going to come back to balance. If you don't let it, then you're going to have problems. I have had people comment on my video here and there, very rarely, but this would be like, you can't do that. You're going to overdo it. And nowhere did I say do this all day long. It's not meant for that. It's an exercise. And you're trying to reestablish balance, not create some alternative reality. As it all comes out, like it sounds like even in the structure of your book that, you lay it out for people to understand that there's a reason why there can be some concern about this kind of thing. But for the same reason, you wouldn't say, hey, the best way to prepare for a marathon is for you to go run 100 miles. And you've never run a day in your life. That's just not wise, as with anything else. You could say that about anything. Too many bananas, too much water, too much exercise, too little exercise. Like you said, the documented negative aspects are hyperventilation. But I heard that there was a study on the difference between subconsciously hyperventilating versus consciously hyperventilating. And the outcomes are different. So if you're controlling it, then the outcome is different than if you're not controlling it. That's why I was saying earlier that I think that is going to be researched more because you're taking control of the process. Anyway, again, another long-winded answer.
It's beautifully said. Beautifully said. Almost everything you're saying is kind of in a chapter somewhere, so it's really interesting to hear you. Okay, so we've got just two more questions. One is there anything else that I haven't asked you about breath that you think is interesting, you think would be important for people to know?
Rhythms and what the differences that can occur with, if you've heard of breathing for blood pressure, they have the clinical research showing that, even breathing cycles reduce blood pressure. They've proven it. They've got, I think, more than 12 studies at this point showing that if you even the breathing cycle out, you can lower your blood pressure. They've created a device, that will guide you through it. Or you can use an app on your phone. I do it with patients. So get the app, set it for this many seconds on the inhalation and the exhalation, and watch your blood pressure come down. And if they do it every day, pretty soon they don't have to do it every day, and it still stays down. So it depends on, and obviously, yes, you could say, well, it's 220 over 115. Okay, first of all, you need to seek help for that, and secondly, still do the breathing. I'm not saying it's going to bring it down 80 points. What it is that it very effectively can bring down 20, 30, easy. And I'm talking as a generalization. Obviously, anything I say, you have to talk to your physician. Make sure you get their approval for any of your changes that you would do with diet and exercise and supplementation and so forth. So keep that in mind, everybody.
Okay.
It's a hard sell, because it's not recurrent pharmacologicals or steroids and so forth. And I think, to me, that's part of humanity taking back or at least learning about what we're really capable of. And we haven't gotten there yet. So we're trying to get the technology to do it for us, which is great because I love technology. But at the same time, we need to try to maybe expend a little bit of effort to improve ourselves and reach our capacities. at the same time. I'm hoping there's enough interest out there that people will continue to go down that path. You know, when we took the research breathing rhythms for blood pressure and just started having people do them, it works.
So the last question, it was not really a question, it's the last part of the book has breaths, and I don't know what it's called right now, it's just called The Breaths. And yeah. I ask everyone that I interview whether you'd be open to contributing a breath, and I really like what you said about no one really owns breath. You know, it's clearly probably been done, but at the same time, it's really helpful, I think, to say have your piece, and then at some point in the book, there you are offering a breath for something. Sure. And so I'm wondering if that you'd be open to sharing a breath that has some purpose or some function.
Yeah, I think the one I can say that I like to tell people generically with only a tiny disclaimer is, which we did put a video up on YouTube about this one, and a lot of patients have found it to be very beneficial, which is when they first wake up in the morning before they actually get out of bed. If they are to do something simple before they get out of bed, then they're usually very surprised at how much easier it is, you know, or they feel like, okay, it's time to get up, it's time to move, right? Because you start pushing oxygen through your tissue. And so pretty simple, we tried to keep it as simple as possible, which was essentially you just inhale and you hold it in, just for a few seconds. I'm not saying, you know, hold it in for 30 seconds or 20 seconds or 10 seconds, just a few seconds. You know, 1,000, 2, 1,000, 3, 1,000. I used to be more specific about breathing through the nose and through the mouth. There are definitely clinical reasons to breathe through your nose, medical reasons to breathe through your nose. But in terms of trying to get down to it, breathing through your mouth will also get the job done. We're not talking about massive breathing exercises here. So you just breathe in, whether it's through your nose or your mouth, and you hold it in. And just let it out any way you want, nose, mouth, whatever. And you do that, like I say in the video, maybe on a good day it's only 10 of those or less. And all of a sudden you feel like, all right, yeah, I'm good, time to get up. Some days it may be like 30, you know, particularly if people haven't slept enough or whatever. It's not a substitute for not sleeping. It's just, it tends to get your brain centers woken up a little bit. The energy wants to move. And so then it makes it much easier for people to get out of bed. And it's just, I know it's a simple little thing, considering people pushing themselves out of bed in the morning is like an epidemic. I think it's very relevant. Again, it's really simple. You inhale, you hold it in for just a few seconds, you let it out. You inhale, hold it in. We're not holding out. It's not an exhale hold, it's an inhale hold. And that's for specific reasons, obviously. But that one I think is probably the most relevant for the most people.
All right, that's really helpful.
So hi again, everybody. This is Dr. Lorn Allison. I hope you enjoyed that. We had a technological failure there at the end, so we just had to cut the last few seconds off. But I really appreciate you listening. Wishing you the best in health.